Angela Clendenin, an epidemiologist at Texas A&M School of Public Health. Angela, good to have you with us. Let's start with these warnings about surge upon surge of coronavirus cases in the US following the holiday period. Just how prepared is the US to deal with a coronavirus surge?
I really think that it's a very serious matter. We're experiencing globally what I would characterize as pandemic fatigue. People have been trying to follow guidance since January, and February, and they're ready to find some sense of normalcy. We're entering our holiday season, and people are wanting to spend time with friends and family. So they're being a little more careless about maintaining physical distancing, about wearing masks and good hand hygiene. So we fully expect in the next 10 days that we will see a significant surge in cases. And we can only hope that most of those will be not serious enough to require mass hospitalizations.
There's a lot of hope about the new vaccines which companies are applying for emergency use for. Do you think there's also a sense among people that, OK, well, there's going to be a vaccine soon, therefore I can let my guard down, I can relax?
Absolutely. I think the news surrounding the vaccine is kind of a mixed bag, as the previous guest was talking about here in the United States. There's a lot of ambivalence about this vaccine having gone through emergency use authorization and what is perceived to be significant shortcuts in the clinical trials. However, the safety and the efficacy data don't lie. These are going to be viable vaccines. The efficacy data is better than we probably could have hoped for early on. But we also are already experiencing vaccine hesitancy before COVID was even a thing. And so I think it remains to be seen how many people will uptake the vaccine and how many people will continue just to not follow guidance and not get vaccinated. So That's going to be our two ways of controlling.
And health experts like yourself across the US are pleading with people to please carry on with the restrictions, please wear masks, please socially distance. Do you think that message would have much more impact if it came from central government?
Well, the way the United States is structured from the founding fathers in our Constitution is that many of the powers not expressly given to the federal government have been given to the state. And in a lot of ways, it does make sense because each state faces different types of disasters, different types of emergencies. So they are able to kind of customize how they respond based on their needs and their resources. However, what helps the most is to have a strong voice from the central government, from the federal government, that supports science, supports this public health guidance. I think in a lot of ways, from the federal government all the way down to the local government, public health has been somewhat undercut in its ability to provide guidance and good messaging.
Some really clear analysis there, Angela. Thank you very much indeed for that. Angela Clendenin there from Texas A&M School of Public Health.